Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Zoe Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's episode. We're talking about learnings in dissections because I've done a lot of whole horse dissections with both myself and Sharon May Davis. I'll talk a bit more about her in a second, but it's been invaluable to my understanding of what's happening inside the horse. How are you today, Soph?
I'm going very well. Yes, super important. I have not done anywhere near as many dissections as you. I've done about 5 or 6, and a couple of those were online. I've done them both with Sharon and with yourself, and a couple for some online courses. And the value of seeing what's underneath the skin, seeing things that are really deep, just gives you a whole different level of appreciation.
Yeah, I remember my first dissection still very clearly, which would have now been, gosh, probably 13, 14 years ago now, maybe. Um, and I think I only could absorb information for the first half day. And I went in there kind of thinking, like, yeah, I'm a vet, my anatomy's not bad, like, should be all right. And then after the first half day, I was like, whoa, I do not know much about anatomy. And I remember thinking, gosh, this lady, it was Sharon May Davis, and I just was in awe of her knowledge of the body, her connection with biomechanics, yeah, the way that she dissected individual muscles, how much care she took, how beautifully she dissected, and how she could really identify the connections. And then, I attended a number of dissections, and then she took me under her wing and mentored me, and I traveled overseas with her and got to do quite a number in a row. And yeah, just kind of recognizing the order through the body. Every horse was so different. Um, and still now, every dissection that I do, I learn something new. Like I got to do a couple closer together this year. So this year I've got to do two um, where I've run them for people, and then a couple at the uni. And just every single time I see a different layer, I see a different level, I see a different muscle differently, I come across something that I'm like, is that normal? Well, I'm normal. You're like, it's just such yeah, it just changes my hands when I'm feeling horses, when I'm examining them, how I see them moving biomechanically. It gives me a different insight, and I feel like I could do thousands of dissections and still be learning something new every single time, and be understanding the body on a deeper level. So yeah, I highly recommend it. I've been in dissections with horse owners, professionals, farriers, trimmers, body workers, physios, like all different vets, all different level of professionals, and I never see anyone leave going, oh, I knew everything about that. And it's awesome for that collaboration, but also just, yeah, for the learning that you get. And it's so respectful. It's not disgusting. It's not bloody. Um, we do it in a very respectful way. The horse was put down for other reasons, not to be dissected. And generally when we are dissecting them, we're like, yeah, it's definitely in a better place. Um, so Yeah, I mean, in some of the dissections, I've been able to see radiographs, and I think the biggest learning out of that is that, we're limited with radiographs in the person who's interpreting the radiograph. We're also limited because we're just really seeing bone. the more we know our anatomy, the more we can get out of a radiograph because you can go, oh, well, that's the attachment of that ligament, or that's like I had a hock last year, which we didn't dissect this horse, but that I was like suspected a fracture in the talus, and I sent it to about five. It was probably looked at by more than five other vets, including specialists, and most of them said I haven't seen that before, and some of them said it was artifact. And I knew from dissection that I see that wear pattern in that area. Not necessarily fracture, but I know I get a wear. We see a wear pattern in majority of horses in that specific area. So anyway, we re-radiographed it. 3 or 4 weeks later, and it was a fracture because we could see evidence of healing. And so, no, having that knowledge from dissections
Yeah.
gave me more confidence in looking at those radiographs and going, like, I really think that's something, even though every specialist was telling me. I think I found one paper that talked about it.
Yeah.
So yeah, just having that knowledge has really helped me in my assessments a lot.
I know that in all, yep, every single one that I've come along to, there have been discussions about things that are very deep also in the body that you can't get to. Like I have some bones from a horse that had an extra transitional rib. So, like where the first lumbar process was actually an extra rib. And so like at the end of the rib cage, you've got your lumbar, and then the lumbar still have these sort of projections off to the side, but they're not a full rib, they're just a short
Yeah,
piece of bone.
yeah,
The
transfer.
trans and so what happens is you can have variation. So the bones that I have, one side is actually a rib bone rather than a transverse process. And instead of there being a joint, because ribs join onto the spine or the vertebra through actually it's a joint itself, they're not a one piece. And so there's no joint there. And so you've got an extra piece of bone that's rigid to a vertebra that pulls out into, around further
Longer.
out into the body.
Yeah.
So there are so many things that you also can't diagnose. They're really deep. There's also other rib issues. I mean, you can have changes to the first rib, and that's underneath the first part of the scapula, like under the shoulder. So there are places you can't get to and other kinds of adhesions as well. So not only limited by the interpretation of the radiograph, you're limited by what you can radiograph, where it is, how deep it is, and also how rare. Like, I mean, if things are really rare, like what you were just talking about, you do still have to go, I suppose you do go through the list to try and figure out what the hell is going on because what's most likely.
And the thing is that some things are rare because people haven't looked for them. It doesn't actually mean that it's rare. Like, we're recognizing that there's more horses with first rib malformations now through Sharon's work,
Yeah.
and where they can have and we've seen it through other people's dissections. Like I think Bexnan showed some images, where a horse had like a rudimentary first rib, where the first rib is pretty chunky in a healthy horse, and there's ones where they've just had like a little string there, or they've had a double-headed rib, or they've had some other variation, and we didn't know that that existed before. So therefore, it was never a possibility. And this is where diagnostically, vets are limited by common things occur commonly, but we look for common things commonly. And so I think there are things that we don't look for because we're not aware that they're common. And because they're deep and they're difficult, and we've historically looked a lot at limbs, and our ability to assess the upper body has been difficult, very challenging. So yeah, the more we can understand that there are things that can be either deeper within the body, or there are things that are more difficult to image, like they're figuring out ways now to image ribs. Ultrasound is a very valuable modality as we get more access to like standing CT options, then we're going to have much more ability to diagnose and become aware of these things in the living horse rather than finding out about it in the dead horse. So yeah, it's always super interesting what we find under
And so,
dissection.
like, just so many things pop up. And then you get to realize, well, based on what we heard, because there's normally always a story that goes along with the horse talking about symptoms, why they were euthanized, different things coming up. And then have a look in the body, and the horse wasn't necessarily lame, but you had some extreme behavior, or you had recurring issues like really bad feet. And that sounds like the reason they were euthanized, but then you find all of these adaptations through the body, through the pelvis and through the spine. And then, they weren't even, obviously the hoof issues, but they're not always categorically lame or consistently lame. And so you have to understand there's a difference between lameness that's showing up and what's actually happening inside the body.
Yeah, and often as we improve our ability to observe posture and behavior,
Yeah.
then we can improve our ability to recognize these things. The more we can observe posture, biomechanics, behavior, we can recognize abnormal function. And whenever we've done dissections, we always take videos and palpate the horses, and so that we get a bit more of a complete picture. And you can see these movement abnormalities in the live horse that, yeah, may not be lameness, but there is a movement dysfunction there. And like you said, I've seen horses be put down because of hoof pain, but then they've had evidence of an old fracture in their pelvis that probably maybe even led to the hoof pain, because of a change in loading. So, and the pelvic fracture hadn't been diagnosed. So, I've seen a few horses now where pelvic fractures haven't been diagnosed, especially of the tuber ischii, which is the point of buttock, because there's so much muscle there and you might see an asymmetry, but yeah, often a fracture in that area is easily missed at the time.
And so, you'd be surprised too, the level of restrictions that you can feel in a dead body, like the skeleton and in the soft tissue, even when they've passed. And, you do exercises where you're doing things like showing how when you lift the thoracic sling and also influence, the position of the head and neck, the engagement through there, like the rib cage actually lifting between the two front legs allows a completely different feel through the head and neck, as opposed to, if you're falling through the front end, what happens through your nuchal ligament in your upper spine. So it's quite representative even in dissection.
Yeah, it's very interesting that, when we peel back all the muscles and we're left with the axial skeleton, so often we've got the pelvis attached to that as well, but the spine, the rib cage, the sternum, and how you can feel like the connections through the horse and the restrictions in there. And, I've had some horses where we do the exercise of lifting up the sternum, but there's some horses that you just can't do it because they've got restrictions in their ribs, old fractures in their ribs, some other neck thing going on. And so, those types of horses wouldn't have been able to engage their core because they don't have the ability to even open, take the brakes off in front, and open that. And yeah, it's really interesting the pressure on the nuchal ligament and how when you lift the sternum under dissection, how the head and neck can go into a lovely neutral position, as opposed to when you put the head and neck in a position in flexion, and how they then kind of can't lift, and how much tension is through that nuchal ligament, which then goes through the back, through the supraspinous ligament. And I think that's one of the biggest things that has blown me away with dissections is the connections, like the anatomical continuity of the muscles, the fascia, the bones, like how, when we learn anatomy, we kind of learn things by muscle origin and insertion, and you learn things by muscles. But then when you do the dissection, it's sometimes, I'm like, where do I even separate this muscle? The fascia is so continuous. Um, yeah, like the muscle fibers, yep, you can see different directions of muscle fibers, but there's often such continuity in the body that it's difficult to make decisions about where to cut. Like I always feel bad about cutting fascia because I'm like, that's so important. Look how it wraps around the leg. Look how it, it connects that muscle to that muscle across the neck. And those muscle fibers are going in different directions, but there's this big fascial sheet there and the different types of fascia that's in the body. And yeah, it really blows me away, that continuity of connection.
Definitely. And how far it stretches too. I've seen now in a couple of dissections with you and with Sharon pointing out the fact that um, there's, a big fascial connection between the neck, the girth area, and then all the way down into the frog. And when you like when you play with a certain area, you'll see fascial pull and movement in those other areas. And this is in, you've lost the skin at that stage, they're laying down, they've already been dead for a day, and you can still see the movement and the pull. So you can imagine like the amount of force that we can put on that space as opposed to how much force they're putting on that space. There's a massive continuity between all of those
Yeah,
structures.
especially when you're like moving the foot and the frog, and then you can feel it up in the neck. Um, like it's a pretty cool connection there and kind of highlights the importance of frog health and motion and hoof health and motion for for function through the rest of the body and the rest of the fascia. I think, one of the big areas that I got to be involved in the dissection of a few conics, which are semi-wild horses over in the Netherlands. And so they're not ridden, they're not handled. They don't have their feet done or anything. And but they browse and they move and they browse a lot. So they're eating like bushes at different heights. Their grazing patterns were amazing in terms of like they graze square, either front foot forward. But the thing under dissection was like the development of their abdominal muscles. They were like so thick and well developed. And their development of their psoas and sublumbar muscles, like their quadratus lumborum, which in domestic horses is really crappy. Um, the development of their psoas muscles. These horses had unbelievable core strength with big bellies, but really well supported backs and they weren't ridden. Like they just developed that through their motions that they did every single day, and I still have not seen abdominals and psoas muscles like that.
Yeah.
Yeah, they were
And
amazing.
those internal connections of the diaphragm, abdominal psoas, they just carry through into the rib cage and then your ability to lift your thoracic sling. And like you said, support the back. One, because the abdominals are um, literally acting kind of like a corset, so single sort of lifting up that space, and then your back stays nice and open. And then when everything's comfortable and moving, you just keep it going. And then, your spine stays healthy because there's movement in there, and then you retain the integrity of like your forward to back motion and your lateral motion.
Yeah, you could really see that through the conics when they moved. Like the flow of motion through their whole body, just eating the way that their eating motion flowed through their whole body, the way that when they urinated and defecated, their posture was all so connected in that moment. Yeah, it is amazing. And I mean, other areas are like the way that the tail muscles connect into the deep back muscles and the way they're continuous along the multifidi, which go all the way up the neck. Um, the way that the nuchal ligament connects into the supraspinous ligament that goes so from the pole all the way to the tail. The way that the nuchal ligament lacks supportive ligamentous structures to the base of the neck and how it's really relying on muscle and thoracic sling function to support the base of the neck. So yeah, it's the connections are probably what have really blown me away over the years, and the way that we've got muscles extending from the pelvis to the neck, like the longissimus, the iliocostalis, um, the the spinalis, like they're muscles that run the entire a big majority of the length of the back. And we obviously sit on them in the middle, and how that's going to influence and potentially increase neck arthritis when the horse is not able to support their posture well.
And of course, you've got wear and tear, like anatomical connections throughout the whole space. Um, there's I know we've talked about a lot that, a change in spinal motion or a change in the ability to move smoothly and well in one area often leads to wear and tear because a change in biomechanics takes you away from your best optimal way of moving that your body can support well. What kind of wear and tear do you often see?
I think it's pretty common to see it around the front of the fetlocks. There's often a roughening across that lip there. That's probably the most common joint. The other one is the hock, what I was talking about before. So in the tailor, so the main joint of the hock, which creates most of the flexion, because I think hocks hind legs are often not tracking in the way that they should be tracking. So therefore you get a wear pattern occurring within that. And elbows would be another area. So there is a normal kind of synovial fossa in the elbows, but what we see when it's been substantially worn is that it affects the ulna, the radius, and the humerus. Um, and sometimes there can be like the joint fluid itself can be inflamed and bloody, and other times it's like being a chronic wear patterned. Um, and I think the elbows and the hocks come under a lot of stress because of what's happening with the biomechanics of the upper body. So the scapular motion comes under a lot of stress if the thoracic sling is not well supported, if the saddle fit is not correct, if they're not being ridden well and in good postures, and then that changes, and the foot balance. Like the elbow is a joint that I think cops that because it's a joint that has a hard kind of stop,
Yeah.
whereas the knee joints, like there's not a hard bone stop. The joints are like open all the way through, and the fetlocks are the same. Whereas in the elbow, because of the olecranon, there is a hard stop at some point, and if the scapular motion is not normal, or the way they step out of their forelimbs is not normal, or the hoof, the way they land and carry that leg through motion is not normal, the elbows tend to cop it. And the same with the hocks, like they have a hard stop in that upper um, joint with the point of the hock. And so again, if that's not able to travel appropriately, you've got hip damage, hip joint laxity, stifle laxity, pelvic lack of function, then the hocks, we end up injecting a heap of hocks because of that altered biomechanics through there. So yeah, the wear and tear I see, fetlocks, hocks, elbows are probably the biggest area, and then obviously spine is pretty high, like sacroiliac joints. I don't think I've seen many healthy sacroiliac
Yeah.
joints.
I know
Yeah.
at the latest dissection with you, there was a lot of changes in the hip
Mm.
as well, changes in the surface, but also in the soft tissue around it as well. There's a lot of motion going through there.
Yeah, I think the soft tissues of the hip can really cop it, especially the accessory ligament, which runs through from the hip to the pubis of the pelvis, and then has a connection into the prepubic tendon, which has a connection to the like adductors and gracilis. And I think we probably get more hip ligament challenges than we realize because we really can't diagnose
Yeah.
that area. But you can see biomechanically a hip that doesn't move well. It has a lot of like internal, external rotation or lateral medial motion occurring. The other place that I see a lot of wear and tear is in the tendons. I've dissected a lot of limbs, more than I've done dissections of the whole body. Majority of limbs have changes in the tendons that are not necessarily being diagnosed. You know,
When you say changes, what changes are you seeing? Like in the tendon, in the bony attachment muscle?
yeah, so especially over the back of the fetlock, like in the superficial and deep flexors, they are often the fibers lose smoothness and continuity, and there's often increased vascularization. And when you palpate through there, there's like an inconsistency in the feel of the tendon. So instead of it being like nice and smooth, regular kind of structure, it's like there's harder bits, um, that like harder striations, and there's like splits between the fibers. And it's really common over the fetlocks. I don't think I've dissected many limbs where that has looked and felt normal. And then sometimes you can feel how the attachment points into like the pedal bone, if we get down that far, you can feel how that's been affected, or at the back of the pastern, how the connections between the tendons at the back of the pastern have been affected, or up at the top at the attachment of the muscles. How that is irregular. And you can feel that specifically in the live horse, like the muscle attachments. If you know, excuse me, where those flexor muscles attach to, you can feel that. And that's why when we address tendon injuries, we have to address the muscles and their attachment points, um, when we're rehabbing them.
Definitely. The complexity of the lower limb and the fascia connections is huge. Like you've got such a fascial connection running down, because you have that deep digital flexor muscle itself coming down the back
Muscle
of the leg. And then at the elbow, it goes through the flexor retinaculum. And so it's like it's kind of held to the back of the leg and it becomes a
at
tendon
the carpus, do you mean?
at the carpus, sorry, thank you. And so it becomes a tendon, then it comes down the back of the leg, and then it comes all the way back down into the back of the pedal bone. But it's come from the elbow, and then there it has its fascial connections into the body, and that comes all the way up through, the tricep and latissimus, um,
Yeah, so
dorsi up into the back. It's so huge, and I think that it often becomes really obvious like at the initiation of movement, at a transition, and in deceleration as well, like the hardness that they travel down through it. But when you're looking at it on the table, it's so obvious. Like if you're seeing the changes there, then it's very it's proof.
yeah, yeah. And I just think over time, I've seen a few eventing horses on the table, and like, yeah, over time there might have been a little disruption of the fibers, and then it hasn't had enough time to heal. They've been overloaded again and again and again and again, and then yeah, they just kind of spend this spend a lot of time in a state of what would you call it? Just like weakness, and they
Just
can
a
never
quick
get back their
disruption.
original elasticity, and fiber alignment, and that's why we have to look after tendons so much in our live horses, and we have to look after their upper body to reduce the strain that's going through the tendons, and then obviously be really aware of our hoof balance so that we can also support the tendons in their interactions with the ground. So yeah, the tendons are a big area of wear and tear.
Definitely. What about fat? Obviously, depending on the horse, there can be a lot of fat or a little fat, and also different kinds of fat.
Yeah, fat is my nemesis under dissection. When sometimes you can't tell either. You look at the horse on the table and you think, oh, yeah, that's a pretty skinny horse. It's going to be nice to dissect. And then you get in there and they've got like heap of intramuscular or intermuscular fat, like between the muscle layers. And often that can relate to them metabolically. So, how they lay down fat, whether they've laid it down like within the muscle, like marbling, we talk about that with cows with the meat, or whether they've laid it down kind of between muscle, and it does change the integrity of the fascia. So I find Like it's much harder to get a nice clean thoracolumbar fascia if there's a lot of fat. I also find they lay it down in areas where they've been loading. So, for example, we had a pony a few years ago. Actually, well, I've done a fair few laminitic ponies, but a pony a few years ago who had a really severe elbow problem, and the fat that had laid down over the hind end was enormous. So you could say it was probably metabolic, but it didn't have that fat anywhere else, and the thickness of the skin and the fascia in those horses that are offloading a front end, like it's trying to add as much stability as it can. So it's laying down a tissue that it's laying down the easiest tissue that it can lay down, which is generally fat. And so the other place it'll do that is around like if I go to cut through a joint capsule and I see a lot of fat around the joint capsule, I'm already thinking like, what's going on in this joint? Like why is it, trying to stabilize itself in a way? So, yeah, you can get kind of extra fat laying down around joints, extra fat trying to stabilize, and then you can get like metabolic fat where you've got a lot of abdominal and visceral fat. Um, and it's more typical of metabolic kind of stuff going on. You can also get a lot of differences in the color of fat, which could be nutritional or stress related. So yeah, the fat can tell us a bit of, I think there's like 7 different types of fat or something. I read a paper about it a few years ago. So
And I
there's
remember it must have been in one of the online dissections talking about organ fat as well. When you think that a horse doesn't look like they're overweight, but then they have a huge amount of fat around their organs.
healthy
It's
fat.
that chronic stress and the placement of that, in the viscera
Mm.
is very different to having it on the skin level. And
Yeah.
that in metabolic horses who have that metabolic stress, that it's more common that you're going to have, even when you can bring their weight down externally, if they're constantly under a level of stress, then that internal fat also shows up.
Yeah, definitely.
What other internal findings sort of come up for
Yeah.
you?
The internal findings, so we look at the guts and I always, it's not my favorite thing to do, which everyone knows.
Especially in the warmer weather?
Oh gosh, but it's just yeah, it's a hard process. But I guess one of the things that amazed me when I first saw like internally the diaphragm, like it's got a big muscular portion attaching to the the ribs and the body, and then a big tendinous portion, and the fibers should be pretty continuous and the tendinous portion should look like beautiful shiny tendon with nice tight fibers, and then your muscular portion, attaches. There's a lot of motion that can go through the diaphragm, but yeah, I've seen a few diaphragms where like the fibers look disrupted, they look like they've been pulled apart, they look like there's scarring in the diaphragm. I know of a horse that's still alive today that's had a diaphragm rupture and had surgery on it. Um, and so, yeah, the diaphragm can come under a hell of a lot of strain, especially with horses that have had like rotational falls or just severe injuries, or, even in racing, I think the diaphragm comes under a heck of a load of strain and they're often tight and then they gallop. So, the diaphragm, I've had some where there's been adhesions to the diaphragm, like with the liver. Um, Also, like I remember Sharon, one of them I did, a couple I've done with Sharon, and she's like looked at the organs and gone, this horse has had a rotational fall, because it had like a scar in its spleen. Um, so I've seen scars in spleens, I've seen scars in livers where, there's obviously been some sort of laceration occur. Um, I've seen adhesions within the gut where, things have been stuck together that shouldn't be. Like I had one where the small intestine was stuck to the large intestine, and it's like, yeah, that shouldn't be
It
like
needs to move.
pretty separate, those two. And I've seen it where the liver was adhesed to the ribs at the back. Like the liver shouldn't even be anywhere near that area, but there was an adhesion to the ribs, the caudal ribs.
Yeah.
Um, so yeah, and then the other one is the adrenal glands. I don't think I've seen very many healthy adrenal glands. Often when I look at the adrenal glands, they look like, and we're getting these out really soon because this is actually the first things that we're looking at not long after we put the horse down. And they often are like flaccid, they lack tone, they're pale, and then we cut them. I lost my words, but we
Transact. Yeah.
yeah, not transect, but anyway, we cut them and we look at the integrity, and the integrity of the cortex and the medulla is there's like calcification and discoloration, and it just shows me how much stress these horses go through. And often when we see these really unhealthy adrenal glands, there'll be like major things going on in the body under dissection, like pelvic fractures and like big pathologies going on. So yeah, horses, I mean, human adrenals really cop it as well when we have a lot of stress, but horses' adrenals really cop it. See a lot of BOTS, like
Yeah.
gastritis and inflammation in the gut, lipomas, and then melanomas, like melanomas under the scapula.
Which
Melanoma,
you can understand would really influence, the slide and glide and the comfort.
yeah, like they can obliterate the muscle, like it kind of turns the muscle to mush.
Yeah.
Um, So, yeah, like if they're just all little pinpoint melanomas, maybe not so bad, but yeah. I haven't dissected many grays because Sharon, would always refuse grays because she has some images of like horrendous melanomas underneath the scapula, around the hip, in the abdomen, around the jaw, and they have a significant influence on biomechanics.
That's interesting. So one interesting thing that I've seen with you is I went to it was a Sharon May Davis dissection, but you were there. And when you remove the brain from the skull, there was a lot of adhesions as well, which is pretty important when you think about the role of the brain and the fact that you've got the cerebrospinal fluid and there should be a gentle ease of motion through that space. And if you've got parts of the brain locking down and having fascial adhesions, then you're going to have a lot of pull all the way through the brain and the spinal cord.
Yeah, I've seen that a couple of times. I mean, I don't tend to, it's not something we do routinely because it depends how the horse has been put to sleep. But we had a 3-year-old on the table many years ago now, and she had a lot of trouble with her coordination. And so, there'd been diagnoses made of shivers and like I think they'd ruled her out that it wasn't neurological, but she was always injuring herself, always falling over, just was really hard for her to move. Anyway, she had a dent on her skull that happened as a fall. And we did take her brain out because we couldn't really find anything in the body that was significant enough to have affected her so much. And then when we went to take the brain out, it was just adhesed to the frontal bone. Like, I'll never forget it because it was actually my first brain, and I'm like, that brain should just scoop out of the skull. Like it shouldn't be, it's got specific membranes around it, but it should come out pretty nicely. And it was just adhesed, like I was using a scalpel to try to separate it from the skull at the front. And that happened as a fall. So, when you see head traumas up around that brain area, which is like above the eyes, kind of between the ears and the eyes, then it can have influenced the membranes of the brain and created adhesions um, in there. So, yeah, that was very interesting.
That's very interesting. In terms of other specific findings, you've talked about elbows in general. How do you think, if you're talking about biomechanics or the influence that pops up, what's the link between what you're seeing and, say, the horse that you might see when they're moving up and alive?
Yeah, I mean, this is the cool thing about dissection is that if you've got the videos of the horse, you can compare what you find to how the horse was moving, and it makes it a very valuable learning experience. And yeah, with the elbows, we often see this kind of elbow wobble happening.
Yeah.
Um, yeah, some people see it more in the shoulder, some people, see it in different ways, especially when they go downhill. There's like a significant elbow instability that occurs. So that's probably a big one there. And like I said, with the hips, you'll often see an increase in lateral medial motion. Um, so yeah, there's more like it kind of sinks away from that hip area because it's kind of lacking lateral medial or adduction abduction stability.
Yeah.
Um, so they're probably two big areas. And then one weird finding that we had was an elbow, which we couldn't get it apart. So we couldn't separate. So usually the elbow is an easy joint to separate. It's pretty open joint. And when I was dissecting it, I'm like, there is something significantly wrong with this elbow. Like I can't disarticulate it. And so that we ended up preserving those bones and you still can't get it apart. So there was a trauma in the elbow for some reason, and this horse had chronic laminitis. It was actually left abandoned. And so there'd been some kind of massive trauma to that elbow. And then the olecranon had kind of grown around and changed shape, so you couldn't separate the joint anymore. It still had a joint because it's very difficult for the elbow to fuse. If it had been a carpus, like a knee, it would have fused. But because the elbow is a very movable joint, it hadn't fused, although one of the people in the dissection knew the horse and said that it did walk with a very straight action in that leg and didn't want to flex it. And all the soft tissue had locked down around it to try to stabilize it. So I've never
Wow.
seen another elbow like that. Um, yeah, that was, and I think there's some weird ones. I've seen a few fractured tuber ischies in the pelvis, and then I also had one horse recently that I saw as a treating vet body worker, and she was a young horse, and her pelvis was messed up, and we improved her function a bit, and then that I said, I think this horse has got a fractured pelvis, and I don't think that she's suitable for a ridden horse or a breeding horse. Anyway, I got to dissect her, and she did have a fractured sacral tuberosity, and her pelvic, it was sitting down about 2 inches below where it should sit.
Yeah.
And then the significant degree of arthritis in her lumbosacral joint on that side was horrible. And then the arthritis that was occurring in her neck from possibly either from the original injury or from compensation from that pelvis. So yeah, when we see significant asymmetries, there's going to be flow-on effects of that throughout the rest of the body, and we need to consider that.
So there are so many ongoing things. I mean, I myself last year, my own horse passed from colic, and the interesting findings after that, he had a few things that stood out over time. And in having his bones now, I know that he had also a tuber issue. So that's the bone that supports the muscle at the point of buttock for horses. So that had been fractured and displaced and changed. And then he'd had another hip injury on the same side with me when he capped his hip on a telephone pole and then had developed kissing spines right through his body and some changes in his neck. But what I mainly saw was hoof discomfort.
Yeah, and I think that when we're seeing hoof discomfort, it's probably a whole nother episode, but I do think when we're seeing hoof discomfort and we can't manage it, we've got to ask what else is going on in the body because lots of people will say, well, all of that came from the hoofs, but like if they've had a traumatic injury to the upper body, you're probably going to struggle to get those hoofs comfortable and balanced,
Yeah.
especially when we understand the fascial connections. that go into the hooves from the upper body. And so I think when you're struggling to create hoof comfort, you've got to ask what else is going on in this horse. Yeah.
Definitely.
Because the
Definitely.
ones that I've seen under dissection, they've, especially like bigger horses, so I'm not just talking chronic laminitic ponies, I'm talking like, you know, bigger horses where they've had hoof discomfort, but when we look at their bodies, there's just significant changes going on everywhere else that not related necessarily to that. And kissing spine can be chicken or the egg, right? Like kissing spine is going to affect the feet, and the feet are going to affect kissing spine.
Yeah, definitely. What, coming to the small bones, what are some things you've seen with the hyoid, which is the tongue bone inside the horse's head?
Yeah, with the hyoid, I mean, I've taken out a few hyoids. They quite can be a bit challenging, but there's often arthritis around the joint, which is just at the base of the ear, which probably comes back to whole body balance, teeth balance, hoof balance, bridle, bit fit, saddle fit, all the things.
Yep.
Um, and so yeah, like often one side will be more difficult to disarticulate than the other side, or they can just often be bilaterally difficult to disarticulate. I've also seen variations in tendons and things like the sternomandibular tendon. I've dissected at least one horse that had the sternomandibular tendon, had an extra tendon going further up the neck where it shouldn't go to, so it should come to the mandible, but I've had it going up um, like up the neck, kind of connecting more into C1, C2. And Sharon's had that in horses unilateral and bilaterally. And if that's unilateral, that means you will never straighten that horse's head. Like it's got an extra tendon on one side of its neck. And so that's where we have to be aware when horses are getting chiropractically adjusted, that if there is um, an anatomical variation there or a malformation in the vertebrae, that sometimes things should not be forced to go into a certain position because there's a reason that it keeps going back. Like if a horse keeps going back to a position, there's a reason that that body needs to be in that position. And whether that's pathology, anatomical variation, there's a reason that is where that body needs to be. And so I think dissections really show you that because you're like, oh, I just thought I was crap body worker. I could never get that horse's head straight, and it's like, no, actually, that horse's head
They,
is never going straight.
yeah. And there's so many, you know, um, places where you can see, I mean, in dissection, I remember you showing adhesions in only one side of the horse's hind leg, between the attachment of the hamstrings coming back down into the back of the leg. So one side, the group of hamstrings, like they're kind of running together and then they become sort of tendinous and then they run down in these tendon lines and they all have a slightly different function, so they slip against one another. But on one side, they've got all these adhesions, so you can't just slide your hand between two muscles when you normally could. You had to dissect out using a scalpel between them. So how on earth are you going to get the same level of slip or motion in one direction as opposed to another space?
Yeah, definitely. And we do see that a lot in the hamstring area, fibrous areas,
Yeah.
and also relating to like the gastrocnemius attachment and the superficial digital flexor attachment into the back of the stifle area. Like I've now dissected a few horses where, and some actually, I'm just trying to think, a few of them have had sore front feet, so it could be, just constantly sitting back in
Loading.
hamstrings and then the way they've loaded and then they've overstretched. But I've felt a few superficial digital flexor attachments where they're so calcified and messed up
Mm.
in that area. And that's a really deep, like it's a very difficult area to palpate. To ultrasound it, you'd have to really know your anatomy to know where, because it sits in between the two gastroc heads. Um, and so you really need to know your anatomy to be able to ultrasound those sorts of areas accurately. Um, so yeah, that's another one. And then, I see the locking mechanism of the stifle, how easily that's compromised in horses when they've got other dysfunction going on in the limb, like um, pelvic dysfunction, lumbosacral, um, groin, and how then they're not going to be able to be efficient in their stifle locking mechanism. And how the stifle, like majority of horses that I see under dissection, there's a flattening of the femoral condyle in the stifle. So means there's been a change of loading in the hind legs. And that's super common. Like I don't think I've seen many stifles where I've seen a beautiful meniscus, which is like the pads that sit in the stifle, and a nice condyle that doesn't look flattened on one side. Um, yeah, so it just depends how they're loading, and then that's going to change the efficiency for a horse to stand in resting if that patellar mechanism doesn't lock to reduce the efficiency of the muscles.
It's a good reminder that straightness, posture, loading.
Yeah, the more we can improve that, the more we can help it.
Yeah, and the fact that it's a long-term benefit because the body does, you know, it's not always that these things are going to change back. Like you might not regenerate your cartilage, but the limb moving straight again is going to influence the soft tissue to have strength in a direction to support the integrity of the joint. So either you don't worsen that condition or you can bring enough comfort to the area that it doesn't have to be, a concern for the horse as they get around.
Yeah, 100%. Like, and that's, what I often call functional dysfunction is like you're always just working to find that horse's optimal biomechanics within the function that's available to it. We might not be able to get it straight and perfect, but if we can just help it to support itself better, we can reduce overall wear and tear and hopefully improve comfort and strength and ability to utilize the core. So yeah, there's lots of things that dissection has taught us. I think another area I see commonly is the biceps tendon at the front of the shoulder, lots of scars and stuff in there. And often the biceps tendon will have an irregularity, loses the smoothness, and I've seen them where we've been able to look at them under ultrasound as well and see the structural changes, especially where the tendon becomes muscle. And also like muscle tears and scars, they're often not diagnosed from a veterinary perspective. Um, and yes, I've seen a number of kind of significantly scarred muscles which are going to a deeper muscles like infraspinatus,
Yeah,
glutes, groin, um, omohyoid, which is super deep, so some of these areas are really difficult to diagnose. Yeah, and I mean, there's papers talking about muscle tears, and we've talked about them before, and they're really important in how biomechanics is affected.
absolutely. Yeah. And just, I think, the overall, well, really a takeaway is that even though you can't image everything, it doesn't mean there isn't anything wrong or that the behavior that you're seeing isn't justifiable simply because you can't see it, identify it specifically, or diagnose it.
Yeah, that's really what dissections have highlighted for me is that
And
there's
that there's rarely one
behavior.
thing.
Yeah, there's always a reason
Yeah.
for the behavior. We never dissect a horse and find one. Like there's always multiple things that have been compensating.
Yeah,
And yeah, there's so many structures deeper that we still just don't have the skills or capability to diagnose. Um, so yeah, it's just creating as best function as we can within each horse's individual structure, and also recognizing how we can kind of help them and when we might be actually hindering them with what we're doing. So observing those posturals and muscle balances and muscle development and recognizing when it's not going in a positive direction as well.
Definitely. Yeah, and that it's worthwhile. If you get the opportunity to go to a dissection, watch one. I know, Raquel, you'll probably have more in the coming years, good opportunities, and they'll be kind of like case studies that, you can really learn about the horse that was, the horse that's on the table, and what that means, for us and what we can do for them. So yeah, it's definitely worthwhile making it to one if you can.
Yeah, and I mean I run a couple, but Sharon May Davis, like she's a guru. Um, so if you can get to her, she has multiple at the Barefoot Blacksmith in Yark, at Avoca Park in Victoria. There are a few regular venues. She also does them in the UK and the US. Sophia Vermeulen and Terza Hendricks, they do some online dissection. So if you can't make it live, you can go to them and see them online. And they're from the Netherlands. There's also Ivana Rudek who does dissections, and Bex Nan from New Zealand. There's Maggie Ashley from Australia. She's in WA. And everyone dissects differently. So, and there's also Deb Bennett, who I don't think she comes over here much now, but she's another person who's been around for a really long time doing dissection. So, such a valuable experience. I will actually give a plug for Equinology. They have an anatomy in clay course, which I've done. And there is one being run in New South Wales early next year, I think in April 2026. With the anatomy in clay, you get to build each individual muscle on a skeleton, and then you get to go out and palpate those muscles on live horses. There's not a dissection involved, but it's all able to be done on the live horses. And yeah, I've done one of those classes, and it just brings another understanding of, muscle connections and attachments, and it's a super cool, interactive, fun experience. So I highly recommend doing that course if you want to explore your anatomy knowledge. Awesome. Well, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights. And we would love to hear any requests that you may have for a conversation.
And we'll see you on the next exciting episode.